Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Ann Albright, Director of the Division of Diabetes Translation here at CDC. Ann, thank you so much for joining us.
Great, thank you.
The session today was amazing about learning about preventing diabetes. We know that about 30 million people in America have diabetes, but more than, almost 3 times that have prediabetes.
That's right.
What is prediabetes and why is it important to know whether you have it?
Prediabetes is a condition where your blood sugar is higher than normal, but not high enough yet to constitute type 2 diabetes. It puts you at risk for developing type 2 diabetes. It also puts you at risk for developing heart attack and stroke. So it is a very important condition for people to know about and to be aware of. And there are 84 million people with this condition. The good news is that it's really a simple blood test that can be done to receive that diagnosis. And even before that, you can have a very simple risk test. It's a series of questions that people can ask. It takes about a minute to do. And based on the responses to those questions, it really gives you a good indication of where you stand as far as your risk for prediabetes. And that really is the critical factor here, is to know where you stand. Know. It's better to know in this case than not to know, because then you can take action and go ahead and get an official diagnosis.
And then when you have the official diagnosis of prediabetes, we have been hearing about a lifestyle change program that can cut your risk of developing type 2 diabetes in half. And I know that your group has been working with people all across the country to bring that lifestyle change program to people in America. Tell me about that.
Yeah, there is good news here, and that's always nice to be able to say that, because diabetes is really a serious, devastating disease. It really is a public health crisis. And so if we can indeed help people prevent or delay, and that's really equally as important. If you can prolong the time in which you would develop this condition, that's really great news. So once you know where you stand, once you've gone through that risk test, once you've been able to see your clinician and get the official diagnosis, there is a well available and a well-known structured lifestyle program that can indeed help you cut your risk in half. If you're over 60, it can actually cut your risk by 70%. So great news on that. The lifestyle program is one in which you are getting information on nutrition, diet, which one would likely assume you would, also get information on physical activity, and importantly on stress reduction, learning coping skills. But the beauty of this program is that you are discovering and learning what works for you. It allows you to really think about things going on in your life, what your barriers are, what your challenges are. And the program is a year long, and sometimes people say, oh my goodness, it's a year long. But I hope people can begin to think about it as, great, I get to be in the program for a year, because it takes time for all of us to figure out how to better change some of the habits and behaviors that we have. And just like your physician would not give you half a dose of medication or give you an inadequate dose, or you would stop in the middle of a procedure that your clinician was doing for you and your health, you should feel the same way about your lifestyle. You should be given adequate time and adequate ability to interact with coaches and people who are supporting you in this group session to really be able to learn and practice those habits. And for your own personal situation, figure out how to problem solve, because we all have different situations going on in our lives, and this program allows you to discover and practice those lifestyle solutions that are going to help you really make lasting changes.
It sounds like it's a fabulous, fabulous opportunity to really make a difference in your life. If somebody wanted to know more about where to join a lifestyle change program or one near them, where would they go? What can they do to join one?
I would suggest first, as we've been saying, to talk to your healthcare provider. Be sure that you've taken that easy risk test, which you can take online at doihaveprediabetes.org. And then again, based on your risk test, speak to your clinician. Your clinician may certainly be aware, and we are working with many partners to help clinicians around the country know where those programs are. Find out from them. You can also go to our website at CDC, which is www www.cdc.gov/diabetes/prevention. And we have a map and a listing of all of the programs. Those organizations that you'll see on our website may have satellite locations. And we're actually working now to improve that locator function on our website so we can get even more details from the delivery organizations. It's important to point out that the program is being delivered in person and it's available to people online or through distance learning or telehealth. It's one of the things that we have been working with all of our partners and stakeholders around the country is to improve and increase that availability. If there's not a program in your area, certainly CDC has excellent materials that can help get you started. We have also, you'll find on that website I mentioned, you'll find other useful, helpful materials about changing some of your eating habits, some tools to help you do that. I always suggest to people to pick one behavior that you would like to start with. So start and build from that. And then also I would highly encourage people, if there's not a program in your area, to speak to your healthcare provider, speak to others in your community, and encourage the development of one. Many organizations are delivering this program, everybody from senior centers to universities to YMCAs to other community-based organizations. So talk to others in your community and encourage that a program be started in your area.
And so healthcare providers could also encourage that if they had patients that they knew were interested in doing that. But what about paying for it?
Well, we have been working very hard with all of our partners around the country to increase coverage for the lifestyle intervention. So far we have a number of commercial health plans, so people can think about what health plan they may be with. We have many examples of those. It's a whole array of them. We don't have everybody yet, but we have many of them. And with health plan coverage, some of the health plans may provide coverage in certain regions of the country or for certain patient populations. There's a lot of variability there. So starting with your healthcare professional and asking about that, that would be a good place to start. But we are continuing that work. We will continue to work in that area very, very diligently. We have also been working on getting Medicaid coverage. And fortunately, we now have some form of coverage going on in about 9 states, but there's a lot of attention to that going on right now. And very exciting, we do now have coverage through Medicare. And that's been a big victory for all of us, that Medicare is now providing coverage for that service. So if you are a Medicare beneficiary, please do, again, talk to your healthcare provider. You can also go onto Medicare's site and look for the Medicare DPP is what it's called, the Medicare Diabetes Prevention Program. It is part of the entire national diabetes program that CDC is leading with all of our partners around the country.
So we've talked about healthcare providers and patients and how it could be covered. Where else could anybody find information about this program?
It really is best to go to our website. That's really the go-to place. But again, talk to your healthcare provider. If you are aware of people in your community, neighbors and friends, so anybody who's going through the program or has gone through the program, share that with everybody you know. People who've experienced this program have incredible stories to tell about what a difference it has made in their lives. And I think it's real opportunity for our country now because diabetes is such a challenging condition. It really can be so challenging for people. For those who have the condition, CDC will continue to work very hard on your behalf. And while we are doing that, we really want to work very hard to help prevent or delay type 2 diabetes. We do have that good news, bad news story. Diabetes is a very difficult and damaging condition. It's also very expensive for our country, and we need to do all we can for those who have the condition. And we need to work very hard to improve the opportunities for those who could prevent or delay the condition. And that's why the National Diabetes Prevention Program is such a fantastic opportunity.
Yeah, and it's been wonderful working with you and being able to bring this topic to Public Health Grand Rounds.
Thank you so much, Phoebe. Really appreciate that.
Thank you. And thank you for joining us for Beyond the Data. See you next time.